वेलकम टू दिस चैनल। मैं डॉक्टर टी एन देवनाथ, डॉक्टर मॉडर्न मेडिकल साइंस, मोटिवेशनल स्पीकर एंड लाइफ कोच। आज इस वीडियो एक बहुत इंपॉर्टेंट कॉन्सेप्ट के बारे में बात करेंगे, क्योंकि रेमिशन, रिकवरी, रिलैप्स एंड रिकरेंस, these are the words actually very confusing. It is very difficult to remember what actually it is. So in this video I will clear all the concept about this remission, recovery, relapse and recurrence. Now you see, remission and recovery, these two are related to recovery, matlab response. Okay, relapse and recurrence is related to disease occurrence. Okay, so when we will talk about the disease occurrence, either it will be relapse or recurrence. When we talk about the response, that will be either patient is in remission or patient is in recovery. So remission and recovery, it is all about the response of the disease. Relapse and recurrence is all about the disease occurrence. Now in next slide will be very clear crystal clear concept there. Now this is the baseline of mood. Okay, now below this line, this is the depressive mode. At this point, if you start treatment, there will be response, and it will take around 6 to 12 weeks. 6 to 12 weeks to show the best response. Okay, so if it is touched the baseline, that means that the patient, that the disease has started remission. To say remission, it has to continue some period of time without any symptoms, that is 4 to 9 months. We can say almost 1 year. Okay, if it is continuing, then we call it patient is in remission. And if patient can maintain that response, that patient does not have any depression and he can continue more than 1 year, then we call it recovery. That means patient has recovered. Okay, this is all about the patient response of the disease. Is the remission and recovery. So remember, remission is 4 to 9 months. Recovery, if it is continuous after 1 year, means 1 year patient does not have any symptoms, that means patient has recovered from this disease. Now in remission, in the phase of the remission, patient may develop some disease, may develop some symptoms, or on the phase of recovery, patient may develop some symptoms. Now if patient develops some symptoms in the phase of remission, then we call it relapse. Or if it is in the phase of the recovery, this is the recovery phase, right? This is the recovery phase. If patient develops some symptoms as the phase of recovery, then we call it recurrence. So remember, my dear friends, relapse and recurrence both are disease occurrence related issues, and remission and recovery is all about the disease response to the treatment. I hope it will clear the doubt about your 4 important terms, that is remission, recovery, relapse and recurrence. Thank you so much.